We get a common question, how to treat autism. And I am taking today to give you my perspective 25 years after my quote unquote fall into the autism world. We're talking about how autism was treated, how it's treated today, 25 years later, and the similarities and differences and where we need to go from here. Hi there. For those of you that don't know me, I'm Dr. Mary Barbera, and I have been in the autism world officially for 25 years now. My firstborn son, Lucas, started showing signs of autism shortly after his first birthday, but my husband said the word autism as a possibility for Lucas when he was 21 months of age, which was 1998. So Lucas was eventually diagnosed with autism one day before his third birthday, and he remains pretty impaired with moderate to severe autism, intellectual disability, language disorders, as well as a couple of medical conditions. But Lucas is doing well. He can talk. He's fully toilet trained. He's happy. He's safe. His major problem behaviors are near zero levels. And so he is having a good life. I am having a good life. But I have a lot of perspective, not just as a parent of a son with autism, but a parent of a typically developing son, as well as my registered nurse background, my behavior analyst background. I have a PhD in leadership. I have 2 best-selling books, The Verbal Behavior Approach and Turn Autism Around. I was an early intervention provider. I am an online course creator, podcaster, video blogger, and an advocate. I've been to 2 due process cases for Lucas all the way up to federal court. So I have been in it very much since the late 1990s. And there are a lot of differences, and sadly, there are a lot of similarities, and we are going to talk about all of those today. And really, with the idea of how do we move forward? How do we move forward so that, we're not in 20 more years facing the same similarities, which are not moving the needle for our children or our clients. Okay, so let's hop into the differences between how autism was treated and just about autism from the late 1990s until now. So in 1999, when Lucas was officially diagnosed with autism, the rate of autism was thought to be 1 in 500. And there wasn't great reporting. The CDC autism rates have been published for every 2 years, I believe, for the last decade or so. And now in March of 2023, the current rate of autism in 8-year-olds is 1 in 36. So we've gone from 1 in 500 for the autism rate to 1 in 36. And it's higher among, still 4 times more boys are diagnosed. So I think it's 1 in 20 something that are boys diagnosed with autism. So the rate has really escalated. And no, I don't believe it's just better detection. I do believe it's better detection. I do believe that it's a spectrum disorder and more kids are getting the diagnosis, but I do believe that there is a real increase based on research. Another difference is that there was no insurance coverage back in the day. Luckily, I lived in Pennsylvania, where some gung-ho parent found a loophole in the medical assistance laws. And so Lucas's ABA therapy, 40 hours a week of ABA therapy, was covered even back in the late 1990s with no copays. It wasn't a perfect system. I still paid out of pocket to fly in an expert, or I think she drove in from Pittsburgh. in the beginning. So we needed more expertise to actually run the program. But in terms of the therapists that came, and 2 of the 3 of Lucas's first therapists eventually did go on to become BCBAs. With the work of Autism Speaks and other advocacy groups, now, today, in 2023, all 50 states do have laws that mandate insurance providers provide autism ABA treatment. So ABA insurance coverage is in all 50 states, but there are exceptions. There are copays. There are waiting lists for that good ABA coverage. So it's not as easy for me in Pennsylvania back in the 1990s, but the vast majority of people out there that have kids Lucas's age in their 20s literally had to like mortgage their houses to pay for ABA therapy. They had to fly in or fly to places to get experts. They had to, train their own staff. And so that is a big shift. And Lori Unum spearheaded a lot of that insurance reform across the country. And I have previously done a podcast interview with Lori, so you can check that out. Another difference is there were no BCBAs back in 1998, 99, when Lucas started showing signs and was diagnosed. So now there are, I just looked it up, as of June 2023, there's over 62,000 behavior analysts, and I was among the first 1,200 of us. I was certified 2 decades ago in 2003 as a BCBA, and then I became a BCBA-D after I did my dissertation on an ABA-related topic in 2011 and met the criteria to become a BCBA-D at that point. So in addition to over 62,000 behavior analysts across the country, there's also over 142,000 RBTs, registered behavior technicians. So with insurance reform came standardization. With BCBAs, which only started as a national certification in about 2000. I became certified in 2003. Then insurance coverage came, and they now have more standardization. Like they're not going to just pay for 20 or 30 or 40 hours of ABA therapy. They want not just a BCBA that knows what they're doing overseeing the case. They want the therapists to have some level of standardization too. So to become an RBT, you only need a high school education, but you also need training and supervision by a behavior analyst. So I know there's people listening that own clinics and own organizations, and you will understand a lot better than I do some of the insurance struggles. So for the parents, it's kind of a struggle because there can be copays and that sort of thing. There also are exclusions, like if you or your partner work in an organization that has less than so many employees, they're exempt from this mandate. If your partner or you work in an organization that has a PPO, they might be exempt. So there are differences in the insurance, but there are very few people that are actually, mortgaging their houses to pay for ABA now. ABA is provided in all 50 states in some capacity. Another difference over the 25 years is the waiting lists have gotten worse. You can imagine with the rate of autism being 1 in 36, the need for, an evaluation by a developmental pediatrician, the the need for a multidisciplinary evaluation through the Birth to Three program, through 3 to 5-year-old program, through private speech therapists, through ABA providers, the waiting lists, especially if it's a very good quality word of mouth spreading person or organization, the waiting list can be quite significant. I did an interview with Dr. Cheryl Tierney Avis a little bit ago, and she said there were only, I forget how many, I don't want to misquote her, but there are not that many developmental pediatricians in the whole country. And even before COVID, the waiting lists for an autism evaluation were 9 months to 2 years. And now, since COVID, I think it's even worse. During COVID, it was definitely worse. I interviewed Dr. Catherine Lord, who is a renowned PhD level psychologist who is an expert on diagnosing. And we talked in her interview during COVID about the need, the wait list got longer, everything was shut down, and how they actually evaluated kids outside and with all these masks and full protections on. And so the waiting lists were bad. Now they're worse. There's lots of people waiting and worrying. And that's really where my mission is, to help all the people that are waiting, worrying, even that have good services. There's always so much more you can learn, because, people say, well, what do you need? 20, 30, 40 hours a week of ABA. The child really needs to be engaged during most of their waking hours, which the average waking hours calculates to about 100 hours per week of the child being awake. And so even if you're getting 20 hours of ABA therapy or 30, there's still a whole lot more hours where the parents, the caregivers, the nannies, the grandparents, the daycare providers need to learn what to do to prevent problem behaviors, to teach language, to teach imitation and play skills, to teach all the self-care skills that kids need. So the waiting lists are a problem for sure. And they didn't used to be a huge problem. I think I waited 2 months to get Lucas down to Children's Hospital in Philadelphia for a diagnosis. That wasn't bad. But 9 months to 2 years, and you're missing the critical window of time when really things can happen, best happen. That's a problem. Okay, so another difference is the anti-ABA crowd. Now that, we've gotten insurance coverage in all 50 states, now we have people saying ABA is not good. And we have people saying autism is a gift. Don't treat any autism, So that's a problem. We've gotten media coverage, but media coverage more so almost all exclusively with the higher end of the spectrum. So it makes profound autism, like my son has, really difficult, because he can't communicate on social media. He can't self-advocate. I have to advocate for him, which I'm glad to do. But I think the whole anti-ABA crowd, and I've done some podcasts. I've done a podcast with what is his name? Bernardo. He's a BCBA, and he's an autistic individual who was diagnosed at 3 or 4 and became a BCBA. He's a special education teacher. That's a great episode. I also did a podcast on the 4 myths and truths of ABA. So my type of ABA is child-friendly, positive, really treating the parent and the child as the center of the program. I encourage and want to empower parents to become the captain of the ship. So all ABA is not created equal. And with 140,000 very well-meaning RBTs and over 62,000 BCBAs trying to do programming and in these complicated cases. And it just, it's not that, I think the quality really varies. And, people on general autism groups are like, should I step away from ABA? When is it time to be done with ABA? And ABA is a science. ABA is happening all around us. There's never a time to be done with ABA for any of us, right? That's the way we learn new things. That's the way we control our problem behaviors and our kids and our clients. And then so ABA is a science, but ABA programs and systems are also developed for autistic kids, and they need to be individualized for the child. And I think as a field, we need to make sure that our procedures are, I forget who said this, like televisable, like made for TV. Like if you had a camera on, would the parents like what you're doing? Would ABC like what you're doing? And we need to make it more child-friendly, more positive, more gentle, and with the science behind us so that the children are making progress. So we covered a couple of differences. The thing that I think hasn't changed, and this is a big problem, the number one thing that hasn't changed is the early intervention system for kids birth to 3, especially, and even for kids 3 to 5. Across the United States, and I know I have people from all over the world, we've had participants in my online courses from over 100 countries, but most of you are listening from the United States. And in the United States, we have a system where it's Part C, which is birth to 3. So if you have a 1-year-old that shows delays, or a 2-year-old up until their 3rd birthday, you call one organization and they provide therapists. Well, they provide an evaluation to see if the child qualifies, usually free or very low cost based on a sliding scale. I always said it was free because I thought it was free around the country, but somebody corrected me that some services are on a sliding scale. But anyway, you call, and if you're sitting out there in Kentucky and you're like, what are you talking about? I can get therapy, I can get an evaluation. Yes, you can, and you should. Even if you're on a wait list for a developmental pediatrician, I would also search in your county, birth to 3 services, San Diego, California, or, wherever you are in the United States, birth to 3 services, find the number, ask your pediatrician or your child's pediatrician if you don't know, or your school district. They should all be able to help direct you to the right agency. You would ask for a multidisciplinary evaluation. That takes some time, and then they'll determine what your child needs. However, with that being said, I just said that the system hasn't really changed. So back when Lucas was showing signs of autism, and my clients from 2003 on, with or without an autism diagnosis, unless the parent was like super gung-ho, like you parents out there that are listening, the child normally gets, from my experience, what I've seen, even today, the child would get 1 hour of a speech therapist, 1 hour of an occupational therapist, and 1 hour of a teacher per week. Now, I just got done saying the child needs to be engaged during 100 waking hours per week. And these 3 individuals are great. They're well-meaning. They've got experience with little kids. They've got experience in their field. But these 3 individuals tend to not be very behavioral. There is very little behavioral science being done in our early intervention system. And that's just until you turn 3. And then you got to go to a new system, which really messes things up when your child is diagnosed, like Lucas was the day before he was 3. You got to go to a new system when you're 3. 3 to school age. So that's another thing you can search for if you're sitting there listening and going, wait, let me see what kind of free or sliding scale low fees evaluations and treatment I can get. The other problem with these 3 individuals coming in, and we've done podcast episodes with lots of speech pathologists, at least one OT, at least one PT, several teachers. I'm not trying to bash anybody. It's just when well-meaning people come one at a time in different days and different times, they're going to be giving you competing advice, usually. That's what happened way back for Lucas. That's what happened for my clients. And that's what's still happening today, 25 years later. And I think one of the keys is that there's no behavior analyst on the multidisciplinary evaluation team, and very few counties would have behavior analysts within the early intervention system. So I do think that that is a big similarity. When you get to 3 to 5 years of age, your child, they stop usually home services with a lot of parent training, and then they tend to recommend, based on their assessments and what's available, they tend to recommend that the child be transported to a center. Again, not many centers that are not standalone ABA clinics have the expertise, have the behavior analysts on staff that can actually embed really good, scientifically proven procedures for kids with autism and even just toddlers showing signs. So this whole early intervention system seems to be stuck in the olden days, and that is really an issue. So in my book, so how should we be treating autism differently in the early intervention system? And why is it so important to get to kids when they are starting to show signs, even if they are not diagnosed, even if they're on wait lists or their parents aren't even thinking autism? In my book, Turn Autism Around, which was published in 2021, in this book, I talk about the great work of Dr. Amy Klin, and he has done a lot of diagnostic work. I did not an interview with him. I did a solo show on his important work. That's podcast number 93. I think it's a great one. And the show notes on that are amazing. So marybarbera.com/93 to listen to Amy Klin. But Dr. Amy Klin said, I attended a couple of his lectures. And one time I raised my hand, during the Q&A portion, and I asked if he thought autism could be prevented. And he said in his long experience, he's been at this for 25, 30 years as well. He said that with his research, he does not think that the gene of autism can be prevented. Well, you have the genetic components of autism, but he is pretty sure, based on his research and his being in the field, that you can prevent and treat severe speech disorders and delays and behavioral disorders that often accompany autism. And that he believes that you can get a child from being, a more severe case of autism to a more mild case of autism. Not every time, not a slam dunk, but the sooner you get to kids, the sooner there's really good parent training on the behavioral way to treat things and have everybody on the team, the OT, the speech, the teacher, the behavior analyst, the parent, all working on the same goals, the same tasks in the same order, keeping the child in a really positive state, child-friendly state. So I think if I had a magic wand that could change over the next couple of years, I would want to really focus on changing the early intervention system to be more behavioral and a positive behavioral approach, and get to kids with or without a diagnosis of autism, to really change the trajectory of their lives. Okay, so basically I have seen a lot. I've seen a lot with my son, with my clients, even with my online participants. I've seen where the autism rate has escalated. There are a lot more insurance providers and people that can, if they're patient, if they know what they're doing, if they're organized, can get on waiting lists and get into the right therapy. There is better diagnosis, there is less stigma, but there's still a lot of fighting among the autism groups, among the camps, among the intervention ideologies. There's also infighting among ABA practitioners. And, there's plenty of kids to help and to serve. And I think the less we fight and the more we work together, the better our kids are going to do. It really breaks my heart that more positive, child-friendly ABA therapy is not available for people right from the start. I have online courses. I just finished the first cohort of my Train the Trainer. I'm trying to get my procedures out to the world because I know how powerful they are, especially in kids under the age of 5, where we can make the most progress. And even if you have a child over the age of 5, like my son just turned 27, he's still functioning language-wise under the age of 5. He's not conversational. He still needs help in a lot of areas. So we can use these same procedures even to help older kids who are still struggling. Anybody struggling, language, problem behaviors, eating, sleeping, potty training, going to the doctor's, dentist, haircuts without a fuss, and really reducing and preventing problem behaviors. I think that's where our focus should be. So in conclusion, I really want to see the early intervention system change. I want to see parents coming, getting trained on their own. I want to see professionals coming to my world, my book, my podcast, my courses, to really help everybody get on the same page so that we can, as Dr. Amiklin said, prevent, reverse, treat speech disorders, behavioral disorders, potty training issues, picky eating. We can treat everything individually in a child-friendly way to help each child reach his or her fullest potential. That's my wish. I hope in the next 25 years, whether I'm here or not, that things are going to be moving forward in the right direction. I mean, we have made progress, but we need to make more, and we need to make it quicker. Hopefully in 10 years, things will be much, much better than they are today. So those are my thoughts, 25 years in the autism world. Hope you enjoyed it. I would be very open to feedback if you're listening, watching anywhere. If you agree, disagree, want to add a point, something I forgot, let me know in the comments. You can always email us at info@marybarbera.com too with your thoughts. I'd love a podcast review. And yeah, let's just keep moving forward. And thank you for being here. Thank you for listening. Have a good one. I'll see you next time.